The World Health Organization says there were 9.5 million new cases of COVID-19 just last week. That's a 71% increase from the week before. Much of it, of course, fueled by the Omicron variant. Infectious disease doctor Zain Chagla joins us now with the latest. And Dr. Chagla, it almost seems like people are starting to resign themselves to the fact that, okay, eventually I am going to get this.
Yeah, look, I think, that was never off the table. The vaccines have done an incredible job making sure that most people have a very benign outcome from their COVID-19. But, this variant can evade immunity. It can evade vaccine immunity to get infected, not necessarily to land in a hospital. And so, with the increased transmissibility and how fast this is spreading, it's going to be very hard for people to avoid this through their lifetimes. There is going to be a risk every day that people who go out into society acquire this virus. And the best thing they can do is get vaccinated to protect themselves against some of the severe complications.
Right. Does that lead us closer to this herd immunity?
Yeah, the term herd immunity really, refers to a very immune population where the disease can't transmit into the people that don't have immunity, right? And it just kind of dies out in the population. So measles, for example, is that. We have lots of immunity in the population through vaccines, and if a measles case would just show up in Canada, it might spread a little bit, but it's going to hit a wall that'll keep it from transmitting. This is a little bit different. We don't have vaccines good enough to really sterilize the nose and mouth from getting infected. They can reduce the risk of severity. Even natural immunity, there is a risk of reinfection, and it's not zero. And so, I think we'll see less of these hospital surges as the composite of herd immunity, which for all of us is exactly what we want, right? If this is a disease that circulates in the community and doesn't lead to the healthcare demands that we're seeing right now, then that's not bad. That's a reasonable goal to get us back to normal.
I want to talk about a very promising treatment that you're involved with, and this is the monoclonal therapy clinic at St. Joseph's Hospital in Hamilton.
Mm-hmm. Yeah, so we've been giving a monoclonal antibody. And antibodies are what our body uses to fight COVID-19. We naturally make them, but there are people who are unvaccinated, who have major medical issues, who are immune suppressed that can't make their own antibodies. And giving them a dose of these antibodies really helps, while they're symptomatic with COVID-19, really helps shortcut their immune system to getting back to normal. So we've been giving these since the middle of October. We've now gotten to about 150 patients. We've had incredible results. We've had less than 5 patients who have required hospitalization. Of those, they didn't require a ventilator. They were all discharged from hospital. And a large number of patients, over 145, that essentially had normal courses that recovered at home. And, the group that we picked to get these treatments had a 10% risk of ending up hospitalized according to clinical studies. So, the fact that all these people that were very high risk were able to recover at home, was a complete success. And this is going to be a drug that's going to be a part of our short and long-term future to make sure the highest risk people can still have access to something to make them feel better and keep them out of hospital.
Right, and you can't be part of this clinic unless you have COVID-19, correct?
Right, so we need people that are symptomatic within the first 7 days of illness, that aren't sick enough to be in the hospital. We can give these therapies to people that are high risk in that group. So not necessarily everyone, but people who have risk factors for severe disease. So those who are older, those who have immune suppression, those who have major medical conditions.
And you come in and you're at the clinic for just a few hours, correct?
Yeah, it's a couple of hours. You register, the nurses put in an intravenous, they administer the drug over an hour, you wait for another hour just to relax and just watch for reactions, and then you go home after that. And most people actually just generally feel better a day or two after they get it as the virus starts clearing out of their system.
I'm so excited for you for this, and so excited that this is going to spread across Ontario. There are going to be more of these clinics opening up in the province.
Yeah, absolutely. There is a plan to get lots of this regionally, so people don't necessarily have to drive all the way to Hamilton. And yeah, hopefully, again, those highest risk people have another layer of protection.
And if people are watching now and thinking, oh, okay, this might be something for me, are you taking new patients?
Yeah, we are. We are constantly taking new patients. If people are interested, go to their family doctors. We've done a lot of advertisement in the city. If you can't get a hold of your family doctor, if you go to the website stjoes.ca/MAB clinic, you'll be able to find the information, the referral information, and the contact information for the clinic.
Okay, very encouraging work. Thank you, Dr. Zain Chagla.
No problem. All the best.